Assalamualaikum and hi, we are from AS120TH. So our topic for video presentation is food allergies and intolerance. So this is the member of our group, Danisa, Fatin, Isma, Halifa and Alia. So next is what is food allergies and food intolerance. For the definition of food allergies, it is an immune system reaction to certain foods. For definition of food intolerance, it is difficulty digesting specific foods. For cause of food allergies is triggered by the immune system, and for food intolerance is caused by enzyme deficiencies or sensitive to food components. So for onset, food allergies is immediate or within minutes to hours. For food intolerance, gradually or usually after consuming larger quantities. For severity, food allergies is potentially life-threatening, and for food intolerance is rarely life-threatening, mainly discomfort. So next is example of food that cause allergies. There is milk, eggs, fish, peanuts, strawberry, wheat, soybean, and crustacean shellfish, which is crab, lobster, and shrimp. So there is some individual that is allergic to this kind of food and give an impact to their body or digestive system. So next is example of food intolerance. First is lactose intolerance. Lactose intolerance is when a person has trouble digesting lactose, the sugar that found in milk and dairy products. This happens because their body doesn't produce enough lactase, the enzyme that breaks down lactose. So the second one is gluten intolerance. Gluten intolerance is a condition where a person experiences symptoms after eating gluten. Even though they don't have a celiac disease or a wheat allergy, gluten is a protein found in wheat, barley, and rye. So next is soy intolerance. Soy intolerance occurs when a person's digestive system has difficulty processing soy and its byproduct. Soy intolerance typically affects the gastrointestinal system. So it happens because the body lacks the ability to fully digest certain compounds in soy, like proteins or sugar. So the undigested soy can ferment into the gut, leading to discomfort. Next is fructose intolerance. Fructose intolerance is a condition where the body has difficulty absorbing or processing fructose, a type of sugar that found in fruits, honey, vegetables, processed foods, and sweeteners. So there are two types of fructose intolerance. First is fructose malabsorption, which is a digestive issue where the small intestine doesn't absorb fructose properly. So the second one is hereditary fructose intolerance. It is a rare genetic condition where the liver lacks in enzyme and needed to break down fructose. So the last one is salicylate intolerance. Salicylate intolerance is a condition where a person reacts negatively to salicylate, which are natural or synthetic chemicals found in many foods, medication, and products like skincare items. So the body struggles to break down and process salicylate, and leading to a build-up that triggers symptoms.
Next is the impact of food allergies on digestive systems. Food allergies occur when the immune system mistakenly treats a food protein as harmful. So, when a person eats an allergenic food, the immune system reacts by releasing histamine and other chemicals to fight the food protein. This causes inflammation and irritation in the digestive system. At the stomach lining, the release of histamine can irritate the stomach, which leads to nausea or vomiting that occurs shortly after eating the allergenic food. This is because the body tries to expel the allergen. Next, the immune response can cause the digestive system speeds up in response to the allergen, resulting in loose stools or diarrhea. Moreover, some allergic reactions trigger acid reflux, leading to heartburn or indigestion, which is aggravated by the allergy in the upper digestive system. Besides, the inflammation and irritation in the stomach and intestines can lead to abdominal pain and cramps. Lastly, eosinophilic esophagitis (EOE) is a condition where the immune system reacts to certain foods, causing inflammation in the esophagus, which is the tube that carries food from mouth to stomach. In response to certain foods, the body sends a type of white blood cell called eosinophils into the esophagus. This leads to swelling, irritation, and difficulty swallowing. The condition is often linked to food allergies. Common triggers include milks, eggs, wheat, soy, and nuts, but it can vary from person to person. Symptoms might include heartburn, chest pain, trouble swallowing, or food getting stuck in the throat. On the other hand, food intolerance occurs when the body has difficulty digesting or processing certain foods. This can lead to a range of uncomfortable symptoms, especially in the digestive system. When you eat a food your body can digest properly, the food moves to the large intestine. There, gut bacteria ferment the undigested food, creating gas and acids. This leads to gas and bloating, diarrhea, and constipation. The first impact of food intolerance is bloating, which is the feeling of fullness or swelling in the stomach. This is because of the undigested food produce gas when it ferments in the gut. The gas will produce as the food breaks down in the colon, which will lead to flatulence and discomfort. Next, abdominal pain can occur because of food intolerance. The fermentation and irritation in the gut can cause cramps or sharp stomach pain. Moreover, diarrhea or constipation are also the impact of food intolerance. The digestive system may react by speeding up, which causing diarrhea, or slowing down, which causing constipation as it tries to process the food.
Diagnostic method for food allergy is skin prick test and immunoglobulin E serum test. First, the skin prick test is a common method to diagnose food allergies. Small amounts of potential allergens are introduced into the skin, typically on the forearm or back, using tiny pricks or scratches. If the person is allergic, the skin reacts by developing redness, swelling, or a raised bump within 15 to 20 minutes. This test is quick, minimally invasive, and highly effective in identifying specific allergens. The second is the IgE serum test is a blood test that measures the levels of immunoglobulin E antibodies which the immune system produces in response to specific allergens. This test is particularly useful when skin testing is not possible due to skin conditions or high sensitivity. The results help determine the severity and type of allergy, guiding appropriate treatment and management. For diagnostic method of food intolerance is hydrogen breath test and elimination diet. First, the hydrogen breath test is used to diagnose food intolerance, especially lactose or fructose intolerance. After consuming a specific sugar solution, the patient's breath is analyzed for hydrogen levels. High hydrogen levels indicate improper digestion as undigested sugars ferment in the gut, producing hydrogen gas. This non-invasive test helps pinpoint intolerances effectively. Next, the elimination diet is a diagnostic approach that involves removing suspected foods from the diet for a period of time and then gradually reintroducing them while monitoring for symptoms. This method helps identify problematic food causing reactions like bloating, headache, or fatigue. It requires careful planning and is often guided by a healthcare professional to ensure balanced nutrition.
Moving on to the next one. So now I'm going to talk about the dietary management strategies. So the first one, we have limit portion size to control calorie intake. Limiting portion size is an effective way to control calorie intake because it is directly helps to manage the number of calories consumed in a meal. By controlling portions, you can better regulate the amount of energy you are taking and making it easier to maintain a healthy weight, avoid overeating, and prevent chronic health conditions like obesity, diabetes, and heart disease. And the next one, we have focusing on balanced nutrition. Focusing on balanced nutrition is essential because it ensures that our body receives the right amount of all the nutrients because each nutrient such as carbohydrates, proteins, fats, vitamins, and minerals plays a unique role in maintaining health. For example, carbohydrates and fats provide the energy needed for daily activities, while proteins support muscle repair and growth. Other than that, we also have meal planning and preparations. For instance, planning meals allow you to ensure that you are incorporating a variety of nutrient-dense foods while helping you to balance your intake of protein, vegetables, fruits, whole grains, and healthy fats. This can reduce the likelihood of nutrients deficiencies and promote better overall health. Last but not least, seeking advice from a dietitian is also important because a dietitian provides expert for individualized advice based on your specific health needs, lifestyles, and goals. Moreover, dietitians also helps to address emotional or psychological aspects of eating such as food craving, emotional eating, or developing a healthy relationship with food.
Next, I will be talking about the potential complication of food allergies. While some allergic reaction may be mild, food allergies can lead to serious health issues if not managed properly. Let's go through some of the most common complications. The first one is anaphylaxis. One of the most severe complications is anaphylaxis. This life-threatening reaction can cause symptoms such as difficulty breathing, a sudden drop in blood pressure, swelling of the throat, and even loss of consciousness. Immediate medical attention is required, and the administration of epinephrine through an EpiPen can save life. For instance, a person with a peanut allergy who accidentally consumes peanuts may experience this reaction within minutes. Next is asthma. Individuals with food allergy may develop asthma-like symptoms including wheezing, coughing, and shortness of breath. These symptoms are often more severe in people who are also allergic to airborne allergens like pollen or dust mite. This overlap between food allergy and respiratory issue can make managing both conditions challenging. The third one is chronic eczema. Food allergy, especially in children, can worsen eczema or lead to persistent skin condition. For example, a child allergic to dairy might experience frequent flare-ups of itchy, red patches on the skin, making it uncomfortable and difficult to manage. Next is gastrointestinal issues. Food allergies may also cause long-term gastrointestinal problems such as abdominal pain, nausea, vomiting, or diarrhea. If not properly managed, this can lead to malnutrition as individuals might avoid certain food groups that are essential for a balanced diet. For example, someone with a wheat allergy may struggle to find gluten-free alternatives rich in nutrients. The next one is oral allergy syndrome. Oral allergy syndrome is another complication where individuals experience itching or swelling in the mouth, lip, or throat after eating certain raw fruit, vegetables, or nuts. This occurs due to cross-reactivity with pollen allergen. For example, someone allergic to birch pollen might react to raw apples or carrot. The last one is psychological impact. Living with food allergies can take a toll on mental health. The constant stress of avoiding allergen, especially in social situations like dining out or attending parties, can lead to anxiety, depression, or even social isolation. For example, a teenager with severe nut allergies might feel excluded from gathering for fear of accidental exposure. In summary, food allergies can lead to a wide range of complications from physical reaction like anaphylaxis and asthma to psychological impacts such as anxiety and social isolation. Identifying and managing food allergies effectively is crucial to preventing this complication and ensuring a better quality of life. So, in conclusion, food allergies and intolerances are significant health concerns that require careful management and awareness. Food allergies involve the immune system and can lead to severe life-threatening reaction, while intolerances typically affect digestion and are less severe but still impact quality of life. Understanding the difference between these conditions, identifying trigger food, and adopting appropriate dietary adjustment are essential for maintaining health and well-being. By increasing awareness and promoting clearer labeling on food products, we can help individuals with this condition lead safer, more comfortable life.